Good morning. My name's Ed Jacobs. I work for District Attorney Tim Cruz in Plymouth County. We're here to talk today about helping traumatized children learn and succeed.
My name is Tim Cruz. I'm the Plymouth County District Attorney, and I've been in that role since November 8th, 2001, which is a little more than 16 years right now.
I think our goals are, first and foremost, is to enhance the capacity of the issues that we're dealing with here for the opiate crisis. I think we also want to make sure that we can continue to get more education and prevention training out into our community. And we also want to make sure that we're going to be able to reduce the supply of the drug. And I think in trying to do that, that is going to be the best way that we can try to, once again, working together, getting the best people that we can, getting the best practices that we can, making sure that we can help everybody in our community.
It starts with a story about 12 years ago. I received a phone call from a gentleman who was a mentor of mine, Ed Olson. He was a school adjustment counselor at one of the elementary schools in Brockton. He relayed to me the following story, that there was an armed home invasion in Brockton on a certain street, and I went and pulled the police report and found out that it was a drug house ripoff. One set of drug dealers was ripping off another set of drug dealers. They broke down the door off the hinges. They had guns. They were masked. They pistol whipped the mother. The son tried to jump in front of the mother and try to protect her, as a 12-year-old son might do. The 5- and 6-year-old were in the other room crying. Drug dealers realized they had the wrong apartment, and they left. And by the time the next day came, Ed Olson had said to me that it was a Friday morning, and he said the 12-year-old, hand in hand with the 5- and 6-year-old, came to school, and they came on time. Well, when they got into school, the school had no idea what had gone on the night before, and so no one said anything. So I just imagine what might be going through those children's minds as they start to think about, how come no one's saying anything to us? And I started to think about, well, what may be the message that they were interpreting? And I think one of the messages might have been, if you would, I guess no one cares.
At its root, we're going to hear more today about the ACEs, and that the more ACEs that a child has, the more at risk that child is to developing health and social problems. ACEs could be like physical, sexual abuse, neglect, incarcerated parents, a parent with a substance abuse disorder, witnessing violence. A litany of factors can be an ACE. But the ACEs study was only half the battle. We needed to know, how do you help the kids with the ACEs?
ACE, A-C-E, it stands for Adverse Childhood Experience, and it's a way of creating a common language across different disciplines and professionals and parents to understand the kinds of circumstances, events, occurrences that might occur in the course of a child's lifetime that are potentially detrimental to their development.
The first thing we did was we needed to look at data. We needed to do two things: research on the data, and then research on best practices. Who is doing this work, if anywhere, and how could we learn from them? We started to set up communication between the schools and the police and the schools. We then became aware of what was called the ACEs study, which was completed in 1998. But again, kind of one of the best kept secrets. ACEs stands for Adverse Childhood Experiences. And so we now started to look at those experiences, and we started to say, how many of our kids have gone through these? How many of the kids in the city of Brockton have gone through these experiences?
What we see on a regular basis in our court are kids that are suffering from adverse childhood experiences. Whether it's a CRA petition, whether it is a delinquency case, in parents and care and protection cases, what has become prevalent is that these kids are all suffering from a significant number of adverse childhood experiences.
I'm Ryan Powers. I'm currently the Assistant Superintendent of the Bridgewater-Rainham Regional School District. ACEs certainly are prevalent everywhere, adverse childhood experiences. And those could be anything from being a victim or witness to violence, being a victim of abuse and neglect, having violence in the home, having someone in the home with substance abuse, really any type of negative situation that you can imagine a child or a family living with, that really kind of falls into that adverse childhood experience category. And then there's certainly a lot more out there that you could probably consider an ACE. What we were finding is that these are the kids that are sitting in front of us, and a lot of them we knew about and some of them we didn't. And so therefore we realized that we really needed to kind of put some things into place that were going to support these kids, the ones that we knew about plus the ones that we didn't, and how can we support them and be proactive.
Rather than just saying a traumatic experience or trauma event, the terminology of ACEs gives us kind of a framework for being able to list out what are some of the kinds of adverse conditions that a child could experience in the course of their childhood that has the potential as a risk factor.
We started to take a look at crime mapping. And when we did the crime mapping, we collected things like narcotics and firearms arrests, where overdoses may have been happening, etc. And what we then did was we put where were our schools on these maps. The reason for that was when we did training with teachers, we wanted to give them an understanding of what was happening in the community when they weren't here. And invariably, every time we did a training, I would have a teacher, 2, 3, or 4 come up to me and say, I come to my school every day at 7:30. I leave every afternoon at 4:30, 4:45, but I had no idea that this was going on after. Well, happened to meet and hear a lecture by Joe Restuccia from the Trauma and Learning Policy Initiative out of Harvard Law School of Mass Advocates. And what Joe talked about was exactly what we were looking for. He had what was called the Purple Book, and that Purple Book we brought to the Brockton Public Schools. We read it, we brought it to them, and to their credit, Sal Tarasi, after reading it, called me the next day and said, we have to do this. Let's get every single principal, vice principal, school adjustment counselor of all 27 of our schools together, and let's see who's interested in further training. And we did that.
The staff was saying, geez, you know, something's going on here, but I don't know how to respond as an educator, and I don't know what to do to help as a school and to help the children. And so really we reached out to the DA's office and the Brockton Public Schools. Dr. Tarasi was able to set us all up and link us. And so we'd offered us a Saturday workshop. And at that Saturday workshop, we had a gentleman from Mass Advocates, Joe Restuccia. Ed Jacobs was there, as well as Nancy Liedberg. I know she's in the back. And really what we started to talk about was trauma. One of the things that Ed was able to do was he showed a map of the city of Brockton, and he kind of showed where all the schools were. And then he did an overlay of some criminal activity. I think the first overlay was maybe of weapons, some type of weapons offense. And you started to see all these little guns on the map all around our school. And then the second one he overlaid was drug offenses, and I think the symbol was maybe needles. And so you saw all the little needles, and again, all around our school. And then he threw a third overlay on. It was a combination of both. And it was at that point that our teachers, it was kind of that aha moment, like, wow, this is what our kids are dealing with in the neighborhood outside of school. Of course, this is why maybe they're acting a certain way in school. It was really eye-opening for us. We learned a lot about trauma, what trauma looks like, what trauma might not look like, because you never really know, and also its impact on students in school. And from there, we also learned a lot from the DA's office just about our neighborhood, what was going on around our neighborhood, around the school, in terms of the environment our students were living in terms of the number of violent infractions, weapons infractions, drug infractions. We really realized that our kids were coming to school having lived through some of these challenges, and this might explain some of their behavior at school and why they might be struggling.
There's specific statutes that talk about safety in the school, and as law enforcement, we can share a lot of information with schools if we believe it's got to do with the safety of the school. I believe all of this information, I think Chief Allen will agree, has a lot to do with safety in the school. Because if there's a serious traumatic incident at a household the night before, that child's going to go into school and be off their game. And that could cause a safety issue for the school. So we're able to share that, never had an issue with it.
Our officers are now being innovative in their thoughts. I mean, Mark Harvey, our school resource officer, he would scour through the log when he would come in on Monday morning, and And think of the number of hours, and then by the time he would find a situation that warranted, say, a kid in need prior to the system, that student was already in, period 3 or had already been in school. Now our officers they know when they respond to this house, they got to handle the situation. But now I've got to enter this can so that the school is going to be able to game plan in advance of the school day starting. And then the team can get together, the school resource officers can then partner with the behavioral specialists and say, okay, how are we going to handle, this student today? Or should we, is there one particular person or approach that we should take? So those are the situations that are happening daily. And I know, we're a smaller department, but across the board with the overdoses, we're seeing the need for that. And, again, if departments do choose to go with that, we do have a built-in, tracking system for that to help us kick that off.
We have trained teams of people within the police department and teams of people within the school department. All school administrators, school guidance counselors, school psychologists, our behavior specialists are all trained in the Kid in Need. And I would like to give credit to Officer Harvey because he coined that acronym, Kid in Need, for us. So that's what we've brought forward in the District of East Bridgewater, knowing that no matter who's on duty, who's in the building, there's always somebody that is well informed of the Kid in Need process. And as it was stated earlier, it's just a name that's given. This is a student that may need a little extra support, a little extra attention. And fortunately or unfortunately, we have seen it come to fruition where there have been students in the school who have experienced something in the home and it has resulted in some, could have been potentially adverse behaviors that happened in the school, but because we had that awareness, we were able to handle the situation a little bit differently. And it really becomes a preventative model because we are relying on this system to help prevent further issues that could be happening in the schools.
We're finding out that much like domestic violence, much like child abuse, we're dealing with cycles. We're dealing with the individual who may be the victim of domestic violence today certainly could be a perpetrator of that crime in the near future. So how do we get in front of that? And I think that we've had a lot of success in getting into schools and talking about the kids who are endangered.
What Brockton found was that, in fact, from 2011 to 2014, of the schools in Brockton, 3 were chosen at random, and they found that there were 80% decrease in suspendable issues and a 43% fewer office referrals.
We realize that, when we talk about academics in school, our big thing, if we have a student struggling, we want to try to intervene as early as possible. So if you have a child that's a struggling reader, the sooner we intervene and get them their basic foundational skills and ensure that they can go on to be a proficient reader, they're going to have success later on in their education. We viewed ACEs really as the same way. We said the earlier we can intervene and try to help these students overcome some of these ACEs aren't going to go away. They've had these experiences, they're always going to be there, but how can we give them the pro-social skills, the coping skills to go ahead and be able to meet some of these challenges? We really need to look at the whole child. So we looked beyond academics. We looked at what type of relationships does a child have, say with adults, with their peers. We looked at their overall health and well-being. Did they spend a lot of time in the nurse's office? Were they chronically sick? Were they, were their basic needs taken care of? Did they come to school fed? Did they have money for lunch? Did they have a winter coat in the middle of winter? So we really looked at those types of things. And we really tried to build our school culture around that. So when a teacher maybe raised a concern about a child, we talked about all those other things.
We know that under the best of circumstances, children's brains are getting constructed, certainly in the earliest stages of life, in direct interaction with their relationships. In the earliest stages of development, the parent, the caregiver, the loved one is holding, touching, kissing, feeding, responding, serving basic needs, eye contact, cooing. There's this reciprocity that goes back and forth between the child and the caregiving adult that literally forms connections in the child's brain and then strengthens those connections over time.
In 2011, in conversation with District Attorney Cruz, we were talking about the opioid epidemic and the numbers we were seeing on that. But one of the things that we were really aware of, and District Attorney Cruz brought to my attention, were who are those kids who live with family members who are have substance use disorder? So we started to take a look at that, and when we looked at it, we weren't happy with what we found, because we started to see that an awful lot of kids were being exposed to another ACE. As you can see from this slide here, 2000 to 2017, and again, look at the time from 2012, right when we started to talk about ACEs and drug-endangered children, you start to see this immense climb. In further looking at the data, we saw that this was not only just for, we were looking at for Brockton, but now we started to say, well, how else can we do this across the county? And when we looked at the county and we looked at the fatal overdoses, we realized right away that this wasn't something that was designated to strictly an urban area, but this was out in our suburbs and our rural areas and throughout the county. We started to then ask the question of all the overdose deaths, where did they happen? Did they happen in a back alley? Did they happen in a parking lot? Did they happen in a restroom somewhere? And when we looked at them and we took a look at that research, what we found was that almost 65% of those overdose deaths happened in a home. What we see is, of the age range between the 20 to 39, is at 68%. Well, that age range is, for lack of a better expression, prime time, parent time. So where are the kids? And who's taking care of them? And they had a marvelous program called Photo Voice. And in that Photo Voice, they came up with a picture. And we used that picture, and it's Johnny has a drug problem, but Johnny doesn't do drugs. So adverse childhood experiences became our mantra, that we needed to get this word out to school systems, to police departments, that we needed to talk to pediatricians, that we needed to get everyone at the school on board, not just faculty, but we also needed to get staff as well.
Coping devices like alcohol, tobacco, opioids are enticing because they provide actual short-term emotional healing, but they lead to long-term risks like addiction. Trauma-sensitive care of children with ACEs is but one, albeit important, strategy in the overall framework of prevention. We fully support the schools implementing curriculum for health classes, presentations for parents, creative anti-drug awareness activities for the kids. However, we also believe that the schools can effectively enhance their existing prevention efforts with trauma-sensitive care strategies. Without trauma-sensitive care, the traditional prevention framework often misses a student most at risk for addiction, the kids with ACEs. Our office continues to work with the Trauma and Learning Policy Initiative. And our goal, quite simply, is to have every Plymouth County School District incorporating this strategy and into their prevention framework. Schools and police departments need to be working together to identify the youth that have experienced trauma as a result of ACEs. If a parent overdoses at home, the school needs to know that someone is at the door that when Johnny walks in the next morning. East Bridgewater calls the kids in need. Our friends in West Virginia call it Handle with Care. And school staff needs to be trained on the ACEs and the practical strategies on how to help the youth coping with the trauma.
You are 46 times more likely to be an injection drug user later in life. When we were working on opioids, we were trying to say, how do we get to kids? How do we get the message to not only kids and parents? But then we thought, well, if we know children have ACEs, maybe what we should do is intercede with those children. Maybe this can be part of our drug prevention strategy. Maybe we can work with the schools and the community and the pediatricians and the police, and we can work with children who have multiple ACEs.
So the Drug Free Community Grant has allowed our office to work with law enforcement, educators, and numerous other agencies to make sure that we can fill in the gaps that exist between a lot of those different groups, so that we can make sure that we can reach out and help the kids with ACEs and help all the other kids in our community by doing that, making sure that we can try to help keep them safe.
My name is Hillary Dubois, and I'm the director of the Brockton Area Prevention Collaborative and High Point Treatment Center's Director of Prevention Services. So I think it makes sense when you talk about looking at substance use to consider adverse childhood experiences. It's a natural progression. You know, when we talk about cycles of violence or cycles of substance use or cycles, you know, families that just can't seem to break out of these things, and you wonder why. It became really clear in some of the instances that we would hear about within a community that there would be mom or dad or grandma or grandpa even struggling with substance use, and then their kids are being raised in those environments where all of these things are continuing to play out, right? So if mom or dad are struggling with substance use, they can't effectively parent. It puts kids in situations where they're neglected, or they don't feel supported, or they don't feel loved or worthy or safe, or they don't have an adult to trust in a meaningful way. Well, what are those young people going to do if all they've ever seen as coping skills is to use a substance? We all experience negative experience and trauma and, have feelings of hopelessness and despair in our life at one point or another. And it's really, really easy to, drown your sorrows in alcohol, or to smoke a joint or take a pill. It's hard to do other things or have other coping skills or mechanisms to try to make yourself feel better. And I think in families where that's just been something that's happened, if you don't break that cycle, if you don't talk about how those adverse childhood experiences play out and will impact that individual, then you're missing a whole opportunity to build resiliency and coping skills within those young adults and children to be able to break that cycle so that they can be proactive, healthy, happy individuals within the community.
So to really get in there to support parent-child, family-child relationships as early as we can in service of that child's resilience, because we know that having that, even just one relationship for that child that is well-regulated and attentive and emotionally well-attuned and loving is the single best protective factor that that child has in the face of risk factors, in face of adversity. So prevention, promotion, and then intervention certainly needs to focus on relationship. Where are those therapeutic relationships that can be cultivated for the person who's struggling with substance use in service of their feelings of basic trust, their ability to be in relationship, and their ability to regulate themselves. Because young children learn that self-regulation in interaction with other people. As people get older, they might need even more structure and predictability to help them overcome that feeling that they can't do it without this additional assistance of a substance that provides that temporary release.
Now the question before us is, what is our response going to be? Will we say, well, that's too bad? Or will we say, we need to roll up our sleeves and every member of our community needs to come together and address this, not only in the prevention, but in the intervention and in the recovery of these children and these ACEs before us.